now that we've, had an opportunity to, um, you know, um, actually define structural racism, I'd like to kind of walk us through some examples of how structural racism impacts health. And we can start with redlining. Redlining was a legal discriminatory housing practice that was initiated in the 1930s by the Federal Housing Administration. And it involved marking maps with red lines or red shading. As shown in this map here, this is an example of a map of Brooklyn, New York from 1938. These areas that were shaded red delineated neighborhoods where mortgages were actually denied to Black home buyers in an effort to steer them away from white neighborhoods. And you can see to the right of the map, there's a legend that grades areas of the map from A to D. And the areas that are shaded in red were actually graded D. And there's evidence to show that the racial makeup of those neighborhoods was actually a pivotal factor in determining what grade that neighborhood ultimately got. And in the red shaded areas and red marked, redlined neighborhoods in these maps, this is where there were actually a high number of Black residents. And so, this was, obviously a highly racist policy. And although redlining is no longer legal today, we do see, how generations, afterward were, negatively impacted by this policy, by this, subsequent racial residential segregation, as well as just a general disinvestment in the communities of Black, Indigenous, and persons of color. And so I've listed here some pathways in which redlining and the subsequent residential segregation of these neighborhoods ended up, causing adverse health outcomes. And for example, there have been a high concentration of poor quality housing in neighborhoods where Black, Indigenous, and persons of color live. There's a substandard quality of the social and built environment, thinking about limited green spaces or parks, for recreation. There's an increased exposure to environmental pollutants and toxins, as well as limited opportunities for high quality education and employment. Additionally, there's a restriction to access to quality healthcare services. And altogether, these pathways can lead to adverse health outcomes, such as adverse birth outcomes, decreased life expectancy, increased risk of chronic disease, as well as increased rates of homicide and other crime. Structural racism can also lead to racial and ethnic disparities. And I think when we look at maternal health outcomes in the US, we see a really prime example of this. To your left, you'll see a graphic which indicates the number or the rate of pregnancy-related deaths among women in the US. And a 2019 CDC study showed that Native and Black women were actually 2 to 4 times more likely to experience a pregnancy-related death than white women. And you can see in the table to your right, shows some pregnancy-related mortality ratios across different categories. And you can see in the rightmost column, these disparity ratios between Black and white mothers in the US. And you can see that, across categories such as age, education level, time period, these disparities persisted. And if you also look at the states, even with the lowest pregnancy-related mortality ratios, that disparity in, pregnancy-related mortality was still present between Black and white women. And scientists have concluded that, and this is not the only study that's showing this disparity, certainly. And scientists over time have concluded that these findings cannot be attributed to differences in socioeconomic status between groups. And in fact, a concept known as weathering has actually been shown to be play a significant role in Black maternal mortality in the US. And a weathering hypothesis is that Black individuals experience early health deterioration as a consequence of the cumulative impact of repeated experience with social and economic adversity, as well as political marginalization. And this cumulative wear and tear over time on the body as a result of the repeated response and repeated adaptation to these stressors is referred to as allostatic load. And studies have shown that Black individuals, particularly Black women, have had higher allostatic load scores than whites. And again, these differences in race cannot be explained by poverty. So on a physiological level, the sustained high effort coping with acute and chronic stressors over time has had real profound effects on health. And again, an example of this is when we see these high Black maternal mortality rates in the US. And I want to take a few minutes to also talk about COVID-19. And, it has become increasingly evident that, Black, Indigenous, and persons of color have, had a disproportionate burden of disease when it comes to COVID-19. And this is data that was collected in over the summer, actually. And so this data is from the end of July into early August. That shows the rate ratios of cases, hospitalizations, and deaths among Black, Indigenous, and persons of color compared to white non-Hispanic persons. And you can see across all communities that the rates of cases, hospitalizations, and deaths are much higher compared to white non-Hispanic persons. And on a note, among Asians in this graphic here, you'll see that there's actually no increase in death compared to white non-Hispanic persons, but this data, more recent data, is actually showing that that is not the case. And so, perhaps there is a lag in some of the data. This is from, again, July going into August. And so we're seeing, these huge disparities when it comes to race and COVID-19 here in the U.S. And you might be thinking, why? Why are we seeing these disparities? Well, the COVID-19 pandemic is a great kind of illustration of this intersection between structural racism, social risk factors, and health. And unfortunately, we're seeing this kind of all interplay, and again, that burden is falling on Black, Indigenous, and persons of color. I've listed several factors here that can influence, the risk of not only, getting sick with COVID and getting exposed to COVID, but also those risk factors that can influence one's likelihood of developing chronic disease, right, like diabetes or hypertension or heart disease, that can actually contribute to an increased risk of severe illness with COVID-19, as well as a risk of death from COVID-19. So this really has a double meaning here. And so I'll go through just a few examples with you in interest of time, but in terms of healthcare access and utilization, when we think about that, a lack of health insurance certainly comes to mind. And there's been documented evidence that individuals of color are more likely to be uninsured compared to their white counterparts here in this country. And this again can make it more difficult to manage a chronic illness, for example. When it comes to occupation, there is an overrepresentation of Black, Indigenous, and persons of color here in the U.S. in essential work settings. And this coupled with a lack of paid sick time and not being able to work from home, which is a privilege, can increase that risk of exposure. Additionally, there are inequities in education, income, and wealth in this country, and inequities in accessing high quality education can lead to lower paid or less stable jobs that may further increase that risk of exposure, those occupational risks among Black, Indigenous, and persons of color. And last, housing is an important consideration. We know that living in congregate housing, such as shelters, as well as having multiple generations living in one household in some Black, Indigenous, and persons of color's communities can increase one's risk of getting exposed to COVID and getting sick with COVID. And so, again, living in these settings can make it more challenging to follow prevention strategies like quarantine and self-isolation. And that's, an important consideration when we think about these disparities. Additionally, there's a greater risk of eviction and homelessness due to disproportionate unemployment rates that we're seeing in people of color in this country. And so I hope, some of these examples that we've walked through together have given you a sense of, again, how structural racism can impact health and lead to health inequities as well as health disparities in the US.